Change to headset. One right for end. Microphone change to headset left for end.
बस कर दो। हाँ,
हो गया हो गया।
Good morning, everyone. I hope I'm audible. So we'll wait for 5 more minutes and then we'll start the session. There are lots of you that are about to join. So let's wait for 5 minutes and then we will start. Good morning. Good morning, everyone. So I welcome you, Dr. Anushka, Gagandeep, Suman, Saheli, Richa. Ajay is from our side. Prem is from our side.
Good morning, sir.
Good morning, Urvi. Good morning, Ajab Rao, Minhaj. Good morning, everyone. Let's wait for 4 minutes now and then we'll start. I request all of you to mute your mic while conducting this session. So if you have any questions in between, you can use the chat box. We can communicate through there. Mr. Prem and Mr. Ajay can answer your queries meanwhile. And this session will have a short presentation of 10 to 12 minutes or 10 to 15 minutes, and then we will have a question answer. So any questions you have, there will be having the short discussions over there. We will be able to solve your most of the queries. And if you have any questions related to the admission process about the courses, we are happy to help.
Bye guys. Bye. म्यूट कर दे वो हो गया सब।
Shruti Lata,
Yes,
could
sir.
you please
Yes.
keep your
हाँ,
mic on
unmute
mute?
करना तो म्यूट तो म्यूट कर दो।
Shruti Lata Singh.
Yes, 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 sure.
Ajay, we can start now, and I see lots of people are about to join, but we can start now, and then we will have conversations at the end also.
So, good morning, everyone. I'm Ajay C. Parmar. I'm Senior Associate at IIPH Gandhinagar, and I welcome you all to the webinar, which we have arranged specifically for the applicants of this year's admission. So, this webinar will we will brief you. We will take you through about the IIPHG, the perspective, the prospects of the courses that we offer, and if any questions or any doubt you have related to the application process, and after which we will brief you about the admission process and about the scholarship that we provide, the facilities that we have at IIPH Gandhinagar. I take this opportunity to welcome Dr. Harsh Shah sir, who is the faculty at IIPH Gandhinagar. and he'll take you through the session. And after that, we will have the question answer session. If you have any queries or any doubt, you can post your questions into the chat box. Our team will happy to host your questions, and we will try to resolve all your queries throughout the sessions. Over to you, Harsh sir. Thank you.
Thank you, Ajay. So this is a new era that everyone has to learn how to be a part of digital interface, and the online or virtual world is another dimension. So welcome to one more step of virtual dimensions. Today, I'll go through a couple of slide decks that represents what we do, where are we, and what the courses that we are offering in terms of different healthcare perspectives. So we are from Indian Institute of Public Health, Gandhinagar. Uh, if anyone wants to have any difficulties about any uh, sequences, they can put the text box also, and we will happy to respond that. So we are from Indian Institute of Public Health, Gandhinagar, which is situated at the outskirts of Gandhinagar. Just opposite this building, there is the Air Force headquarters, and nearby we do have a NIPER, which is the National Institute of Pharmaceutical Science, and besides that, we do have a IIT Gandhinagar. So this is a very large green campus. It's about almost 50 acres land. You can see lots of greenery, and the animals also, reptiles also during the monsoon periods. But we make sure that you remain safe and stable during these hard times. So we are at the river banks of Sabarmati, and this is the Institute of Public Health Excellence. Next. So we had started with the help of state government of Gujarat. You can see the couple of photographs where we had been placed in the different directions. So in 2007 and 8, the IIPHG has been established with the help of state government. So the current PM, Prime Minister Mr. Modi, had inaugurated our foundation stone laid down into the 2007, and then the Public Health Institute of India, basically. Across the India, there were very few institutes, and IIPG was one of them that was established. And in 2015, we received a university status from the Act, IIPG Act of Government of Gujarat. So since 2015, we had initiated our academic journey and included lots of courses and the students also. Next slide. So looking at the credentials, what we have as per the IRF ranking 2025, we are first in state and second in West Zone. As per Gujarat State Institute ranking, we are the 5-star ranking of universities across the states. Apart from that, in the domain of healthcare, our 5 faculties have received uh, awards from Stanford University, and they are among the top 2% of researcher in the world. So these 5 faculties are taking our IPHG to the next level, and uh, we have been engaged in various governments programs and the policy at state level and at the national level. And some of our faculties are working at global level with the different universities like LSTM and also Bonn universities, the Australian universities, the John Hopkins. So most of the faculties do have a exposure of national and global health policies, and they are working with the various interventions. Next slide. So now coming back to the points, so we will keep mostly focusing on the our academic courses that we are going to discuss here. So we are offering Master of Public Health, uh, which is the two years of residential training program. Similarly, we do have a Master of Hospital Administration program. Uh, Apart from that, recently we have launched Master of Public Health with the track of public health nutrition. So these 2-3 courses are our benchmarks that are providing a large level of exposure to the students also, and to the alumni. They are now working within the different NGOs, different UN institutes, and different companies also, and with the hospitals background. We are also offering Doctors of Philosophy, PhD programs, and recently this year we have started integrated BSc with the Master of Public Health and Hospital Administrations. IIPHG is also offering various e-learning programs to the graduates of public health and hospital background, or any medical science background students who wants to pursue new skills and new knowledge. So they can go through our websites and can explore the e-learning programs that starts from 3 months to 6 months to 9 months period, and also some of the programs that provides PG diploma in health and hospital background. Next slide. So for MPH programs, these couple of focus subjects we are teaching that equip you to go ahead with the markets and to apply for various organizations in the government also, and non-government organizations also. If you see the landscape of Indian healthcare system, so in healthcare system that are run by the state governments and the national governments, they are mostly backed by national health programs and the services of the hospitals that they rendered through the different schemes. Similarly, in the NGO sectors, there are lots of players. There are state level NGOs, there are national level NGOs like JPIGO, the Union, the IP Global, JSI. There are NGOs that are working across the state like ADRI in Bihar. There are Gates Foundation that provides financial supports to all these organizations. There are WHO that provides the technical guidance to various communicable diseases, and also the vaccination program. So we align our subjects based on the market requirements, and these entire subjects will be taught to you across the 2 years of period. So these are the semester system. There will be the 4 semester system, and each semesters we start from adaptive learning phases that starts from basics to mid level, and then we in the last semesters we reach to the advanced level. So these are the couple of subjects that we used to teach you, and that equip you to weaponize you with the market demands. Next. So as I said, there are various career prospects related to Master of Public Health graduates that starts from government sectors. There are National Health Mission that provides large opportunity to the various mid-level managers. And if you are senior, then you can land up with the consultants and surveillance officers kind of jobs. In government sectors, the health system is the main player who employed the large level of mid-level managers that who had graduated Master of Public Health. In non-government sectors, there are lots of players also. And there are ICMR. There are almost 22 sites of ICMR that hires the researchers, research assistants, and scientists also. So if you equip with knowledge, if you equip your build yourself to up to certain levels, you can land up the jobs at ICMR also. And in private sectors, there are lots of consultancy programs, and you can create your health startup in recent times. Next. Next. Yeah, in MHA, also we used to teach you the operations of hospitals. Apart from that, we used to teach you the managerial capacity. So you can build your managerial capacities and apply those capacities to the large chains of hospitals. So we used to teach you the management principles. We used to teach you managerial economics, financial accountings, also the marketing, hospital computing. And if you are in the business of developing the hospital chains, we used to teach our students to hospital planning, quality, and logistics. So recently, if you have heard about NABH, JCI, these are the criteria that every hospitals they have to acquire to be eligible for the insurance claim, certain insurance claims. So there is a long list of consultancy agencies. There are long list of hospitals who seek these kind of experts, those who are graduated MHA program. Next. Yeah, that we had covered. Again, in hospital setup, the government is another player who used to hire the candidates who had graduated Master of Hospital Administration. So they seek certain skills that can support the hospital superintendents or hospital in charge to run the day-to-day operations smoothly. Next. Recently, we have launched public health nutrition due to the high demand and high uh, absorption rate of particular topic. So you must be knowing about the malnutrition, the obesity. We are, as in India, we are fighting with the both dual burdens of this complexity. Uh, and based on the demands of the markets, there are lots of organizations who seek Master of Public Health with the track of specialization in public health nutrition. So we had started this course, and till now we had completed 2 batches. One batch is about to complete, and second batch is going through the internship. And these are the players, these are the students who had skills to understand the nutritional landscape related to the public health and the health sector. So we used to teach you the foundational of nutrition, human behavior. Also, there are courses related to dietetics that understands the different food items, like how to the carbohydrates, protein, and the minerals and vitamins, how they are going to work within their body. And you can be you can work as a dietitian for the hospitals and for the community programs. Also, we used to teach you the research, how to conduct the research on nutritional interventions, and how you can create your research to cater different solutions, to derive certain solutions for public health problems. So these are the courses that we are teaching you during this MPH program. Next. It is similar to the Master of Public Health, but the focus is more on the nutrition part. So, similarly, the jobs that are available within the government sector that are specifically the programs that are working on maternal child health nutrition, and now the NCD program is taking a huge shape across the country, and government of India is pushing lots of funds to improve the health of people, related not only related to the diabetes, hypertension, or cardiac disease, but also on the mental health. So couple of things that are being provided by the government, and there are positions in the government that if the graduates from PHN can land up to the job within the sectors. And there are international organizations who seek a specialized knowledge and skills of a person to run the program. So these are the uh, career prospects for MPH PhD graduates. Next. We have almost 15 faculties. They are going to teach you across the 2 years of period, and these are the multidisciplinary pool of faculties with vast experience of healthcare industry. So some of the faculties are experts in the hospital operations, some of the faculties are experts in behavior change communication, some of the faculties are experts in data analytics, and some of the faculties are experts in AI and digital health. Some of the faculties have worked in WHO for almost 15 years. So these are the faculties, they have been graduated from the national institutes, national universities. Some of the faculties have been awarded PhD from international colleges. So we do have a mixed pool of faculties that are working constantly to improve a student's career and also build them to the up to the level that market requires. Next. Next, yeah. IIPHG has lots of experience with the different centers. So we have been recognized as a Center for Excellence of Research by the ICMR. ICMR is the apex body of India who designed the research based on the country's health problems. So the ICMR is a apex body, and we are one of the center of excellence that are collaborating with ICMR and government institutes. Apart from that, we do have lots of center for excellence. We do have a center for nutrition. We do have a center for NCDs, working on NCD health issues. We do have a center for One Health, which are working with zoonotic diseases and human interaction. We do have a techno incubation center. IIPHG do have a startup techno incubation center, which provides the startup support to various healthcare specific startups and provide them the incubation. So these are the some of the centers that are within the IAPG has been established to provide long-term prospects to the students also with the various exposure in different organizations, and they are also working with various organizations where the IAPG can improve healthcare problems across the India. Yeah. Next. We have been collaborating with various organizations, international organizations, UN organizations. We have been also been part of various MOUs with the management institutes like IIM Ahmedabad, IIM Bodh Gaya. There are IIM Hyderabad, ISB Hyderabad also. So we have been working with various national level institutes, and also we have been part of various discussions and projects with the international institutes like the University of Sydney. Recently, we have been working with University of Melbourne on digital health, on the mobile applications with the health dimensions. We have been working with Karolinska Institute, Sweden, for various research protocol. Hi, Joel. I guess my audio is there. Ajay, can you hear me?
Yes, sir, audible, sir.
Okay, okay. So I guess, Joel, you need to walk somewhere around your system. Okay, let's move forward. Apart from that, next slide. Yeah, these are the couple of renowned universities that we are working currently. With the John Hopkins, recently we have been working with the research on uh, CPHC, community-based primary healthcare. We have been working for the digital health on John Hopkins universities. These are the universities that are providing the technical supports to our institutes, and also we work with them closely for research and various implementations of public health importance. Next slide. Yeah, similarly for national universities. Next. So this is the campus. You can see a lush green campus. The campus, the building has received the Green and Clean Health Facilities Award. So we have been awarded for the climate resilient building. We have been working towards those areas also. You can see lots of plantation within the campus, and the building is so beautiful. I've been a part of IIPG since last 5 years. I've been working in government for almost 15 years. So recently I have been a part of IIPG, and once I came here, I love the campus, I love the atmosphere, and also the working environment, the teaching environment across all the courses. Next. Yeah, the student life is vibrant as you see in movies, but that not much fancy, but it's quite realistic. We allow the students to work uh, for being a professional. We also build their management skills. We also train them to have a better communication for their careers. Because if you see the public health, hospital administrations, and the public health, nutrition also, these are the specific jobs where you get lots of respect. So we train the students. We taught them to build a professional personality to the entire 2 years of period, and also infuse the required knowledge and skills to withstand with the current community demands and the market demands. Next. All the lecture halls, we do have an auditorium also, we do have a lecture halls also that are equipped with latest audio visual equipment. So the most of the sessions and most of the lectures are in English, Hindi and English. Simultaneously, the visualization, so the board, whiteboard, blackboard, and also the digital medias that are being used. So in my lecture, you would be seeing the videos also, the short stories also. You would be seeing the role playing between the students by learning based on the examples or the case stories through the animated platform. So we use lots of digital tools while teaching you. We do have a cultural and social sections every year. We used to receive students from across the country. So last year we had received students from almost 20 states, and students used to celebrate their religious festivals also, whether it is Onam, whether it is Navratri. So it's in Gujarati, so Navratri is official festival of Gujarat, and so the campus. Similarly, we used to organize the uh, every year we used to organize a national conference that only for students and uh, organized by students, played by students, and completed by students. So students play a key role where you will learn the leadership skills and teamwork, and also you get lots of exposures from the experts. We go for the social responsibilities also. We run the plantation drive, we run the awareness drive. There are lots of batches that they had conducted the flash mobs. Some of the students had achieved or the part of Guinness World Record for music, their love for music, their love for dance also. So we encourage the students to live their life, not only for the textbooks. Next. Yeah, students are performing well and they had achieved lots of accolades across the country and across the recently last couple of batches. Students have been working with Germany, working with Australia, uh, through the various grants and various research scholarships or various opportunities that they had captured during our 2 years of period. All the faculties have been supporting in to the students. So in IIPHG, whomsoever gets the admission, they have been allocated the mentor. So suppose I am a faculty, I do have a 15 students that I have to mentor. So on the day-to-day, their queries, for the technical queries, for their academic queries, I am there to resolve them along with the academic and the the student welfare team. So these are the achievements that you can see, and most of our students have been a part of major policy change within the India. Next. Next. Yeah. The our learning and our teaching is not limited to the classrooms. As you can see, we take the students to the health facilities, take the students to the various startup organization, take the students to the various hospitals, take the students to this is one of the photo of 108, which is the emergency services across the Gujarat. So we used to take the students beyond the classroom. We take the students to the community also to understand the challenges that they are facing for their healthcare. So we used to take them to the field visits, and we encourage them to learn uh, the nuances of public health or the hospital part. So in a person, those who have not learned the public health or the hospital administration, they do have a general understanding what the layman has. But once you acquire the knowledge, once you acquire the information, then your perspective gets widened. So during those periods, during those modules or courses that are being taught, we used to take the students to the community, we used to take the students to the field visits to learn something new and to churn their existing beliefs that can be built up with more information and knowledge. Next. Yeah, this is the conference that I was talking about, the ACs. Next. And at the end of the 2 years, you will be awarded with the degree of the convocation. The yearly convocation used to be held in December. So after graduations, at the end of your graduations, you will be awarded the degree certificates. Next. Yeah, about placement, the most important questions we used to receive from the applicants, that how the students are being placed. So as of now, over the period of lots of batch, I guess more than 10 batches that we had completed for MPH, and more than 8 batches we have completed for MHA. No students have been left without a job. Those who seek job, those students who want to create for them something new, so they had started working as a consultant. Some of the students had opened the NGOs themselves. Some of the students had opened the consultancy for the hospitals, for the quality certification. They assist them to improve their quality assurance models or the framework. Some of the students have started the startup also, and they have been working for their startup. And we encourage the students to be whatever they want to be, and we also help them during that process. So not only up to the 2 years, we support the students for the placement beyond our graduation. So this is one of the critical part and innovative things that we used to do. Most of the students be in touch with me also, those who are my mentees. And whenever one of the students used to seek, sir, I need a job, I have left the previous job, can you direct me to the potential opportunities? So whenever I come to be in that information, I used to pass them. If not, and they used to come in information, we used to teach them how to crack the interviews and what could be the possible questions that may come to you to grab that job. So some of the our students have been placed very well across the countries, with the national organizations, with the NGOs also, and with the uh, this state level NGOs who had created a technical support unit. So entirely workforce of 50 that are supporting the state health department to improve their public health problems. So these are a couple of students who have been working with WHO, with ICMR, uh, working with the largest development sector health organizations. They are working with ministries also. So these are a couple of uh, examples that we are showing. Not limited to this MPH, but also the MHA graduates also. They have been working with state government. They are working with consultancy organization like PwC, like Health Arc, Medicines. Some of them are working with Quality Council of India. Some of them working with the ICMR organization or with the government hospitals. Next. On the scholarship part, we facilitate all the students who are eligible for the government scholarships. Apart from that, IIPG is providing scholarships based on various criteria. So there are certain criteria where you will get the scholarships, and these are the criteria basically directed towards the uh, certain benchmarks. So the income benchmarks, the merit background, the performance during the OCs. These are the couple of things that we consider for in-house scholarships. And also we facilitate, our team is facilitate you to get the education loan if required. So all the documents that are necessary, the team led by Dr. Vijay and led by the registrar Dr. Anis Sinha sir, they used to facilitate all the requirements. Yeah, next. So let's sum up the presentation, Ajay. These are the free. I guess you all have been gone through this information, so no need to repeat myself to these informations, and let's open the group for the discussion. And let me tell you this one. Ajay, can you go with this? The admission test. Lots of queries are around there. Ajay, can you hear me? Prem, are you there?
Yes, sir. Yes, sir. I'm here only.
Yeah.
So just a minute.
Yeah,
So
this one.
basically, during the admission process, we will consider the three criteria. First is your academic performance, your graduation degree, and score which you have got in your graduation. Apart from this, we will conduct the online entrance tests during June first week. On 7th June, we have scheduled the online entrance test. The login ID and password, it will be a proctored exam. Our team will share you the login ID and password most probably by 1st or 2nd June. And we will provide you the time to appear for the mock test also. 40 MCQs will be there. It will be a 50-minute test. 40 MCQs will be there, which will cover the basic maths, English, reasoning, general knowledge related to health and hospital focus. Each the marking scheme will be 1 mark per question, and there will be no negative marking. After that, those who qualify the screening test, we will call them for the interview. The interview would be, we will be providing the options to students. They can appear online also, and they can come to campus also. Our team will share a preference link to the selected students. If you wish to come to campus, you are most welcome. If you wish to appear for the interview online, you can also appear. The criteria which will be covered during the interview, the presentation, the personality, the motivation to join the specific course, your general awareness, and other extracurricular and subject knowledge.
So that's the simplest test that we used to conduct. So most of the students used to get marks. They pass this entrance examination, but the main challenge comes with the personal interview. So uh, I would say that you should put your efforts to appear in exams. So for the exams, you put your efforts 30%, but for personal interviews, though the marks are 50%, but you need to put your 80% there to present yourself, to answer yourself for interviews. And interviews are basically more friendly. You can provide the answers if you are comfortable in Gujarati, if you are comfortable in Hindi, if you are comfortable in English. So most of the faculties used to know these three languages. Some of the faculties used to know the different language also, but I am not equipped with that of skills. So the 31st is the last.
Yes, sir. I just wanted to add one thing, sir.
Yeah.
We used to receive a call and email from the students that their last semester result is pending. They have not received the specific documents, and for that they have not completed their application. We just wanted to request you, if your last semester mark sheet or 7th semester mark sheet is pending, you can still complete your application. If there are any document which is made compulsory, like school leaving certificate, and you do not have, like migration certificate, school leave, the transfer certificate, you can
As of
upload
now.
your last mark sheet over there, and you can complete the application. We will be requiring those documents as and when you are selected, and our team will be doing the document verification.
Yeah. So as of now, for the application or the completion of that application, you would, if you do not have the certain documents, it's okay. You can complete the application, and at the time of document verification, after you got selected, you can verify the document to the concerned team. So no need to withhold yourself if there is no documents. Yeah. So that is the part of entire application process. If you have any queries, these numbers are already communicated to you. But at the last, the Ajay, Prem, and other team members would be available for you anytime you would need any support or any assistance. Yeah, thank you everyone. Let's open for the discussion. If you have any questions, you can unmute yourself, you can introduce yourself, and then please ask the question.
Sir, just wanted to add, sir.
Yes, please
Hello.
go ahead.
Yeah. So, guys, sir, we had other questions also. Two main things like if we are having percentage or if we are having CPG, how we can enter those things. So, if you are having CPG marks, you can convert it into percentage and then enter. Okay. And if you are having the yearly mark sheet, then you can enter it in the order of like first year into first semester, second year into second semester, and third year into third semester. So these kind of work troublesome will work out and you will be able to submit the application.
Yeah. So yes, let's open for questions. Maitri Shah. Yeah. Please
Yes, good
unmute
afternoon.
yourself. Yeah.
Yeah, good afternoon, sir. I want to ask you that what is a different role in masters in health administration and hospital administration? Like, they both are different courses or
Yes.
like same?
So for public health backgrounds, the course are entirely different, and the job opportunities will be entirely different. So in hospital administration, आपको hospitals में काम करना पड़ेगा, आपको hospital operations में बहुत सारे department है, quality department है, support agencies department है, marketing department है, insurance department है. So where you are going to work there. But in the public health, there are certain sections. So child health एक component है, तो if you are equipped with sufficient knowledge, you can work with the child health. गवर्नमेंट ने अभी रिसेंटली HPV वैक्सीन रोल आउट की है, ह्यूमन पेपिलोमा वायरस वैक्सीन. सो दे हैड हायर्ड लॉट्स ऑफ एक्सपर्ट्स, लॉट्स ऑफ पब्लिक हेल्थ प्रोफेशनल्स टू रोल आउट अक्रॉस द कंट्री. तो वहां पे क्या हो रहा है कि 9 to 14 ईयर्स की गर्ल्स को वैक्सीन देनी है, तो उसका माइक्रो प्लान बनाना है, वैक्सीन डिलीवरी सिस्टम कैसे एस्टेब्लिश करनी है. सो दैट वे यू आर वर्किंग विद पब्लिक हेल्थ. My say is for public health, you should not keep the boundary key. If you are working with certain geography, geography is a constraint. So don't limit yourself in the public health where you will get lots of opportunities. Recently, AI की बहुत सारी बातें चल रही है. Now AI is becoming आलू of every सब्जी. आप कहीं पे भी जाओगे AI की बात होगी. तो recently I've been working in AI diagnostic जहाँ पे chest X-ray का AI मॉडल डेवलप हो रहा है और वो रोल आउट हो गया. But to gather those data, we had required lots of researchers. So we tends to seek public health researchers to create a study design and to get those data. तो public health पूरा अलग है और hospital पूरी अलग है और उसकी job opportunities different है. Yeah. I
और
hope I'm able to
कहीं
answer, Maitri.
yes, sir.
Yes.
मास्टर्स इन हेल्थ एडमिनिस्ट्रेशन और हॉस्पिटल एडमिनिस्ट्रेशन तो दोनों का रोल सेम ही होता है, तो मतलब ऐसा कोई डिफरेंस होता है कि अगर हेल्थ एडमिनिस्ट्रेशन कुछ स्टेट्स में किया हो, लाइक आई हैव completed my bachelor's in physiotherapy, so I have done my internship at one hospital. So
Mhm.
there are some people who have done masters in health administration and they are getting managerial jobs
Yes.
also. So like they both are almost same, or like I don't understand
Yeah,
that.
yeah. So some of the institutes tweak their nomenclature. So as per the UGC, health administration or hospital administrations को similar degree पे माना जाता है. And most of those who are working within the setup, they had conducted almost virtual or hybrid type of graduation. तो वो एक डिप्लोमा सर्टिफिकेट होता है हेल्थ एडमिनिस्ट्रेशन का, हॉस्पिटल एडमिनिस्ट्रेशन का, और वो एडमिनिस्ट्रेशंस के बारे में ज़्यादा होता है रादर देन वर्क एज ए प्रोफेशनल्स. तो वी हैड ए मास्टर ऑफ हॉस्पिटल एडमिनिस्ट्रेशन एंड मास्टर ऑफ पब्लिक हेल्थ. तो वो एज पर द यूजीसी में दोनों अलग है. बट व्हाट यू आर सेइंग, दे आर मोर और लेस सेम, that some of the organization tweak their nomenclature and work around the administration only within the
Okay.
health setup. Yeah.
Okay. And also, sir, I also want to ask that after completion of MHA, or like I personally am interested in MHA, so is it necessary to do the MBA for higher growth in like private sectors or
No,
hospital? Because
no,
like,
no.
is it like that if I have done MHA or someone has done MBA, then they will get a good opportunity rather than me?
So let me tell you, for job landing, it's all depends on the person. We teach you almost everything about the management skills that are being taught in the MBA also. We used to teach used to teach the communication skills also. We used to teach the hospital operation. So बहुत सारी बार क्या होता है कि क्लास में हम सबको पढ़ाते हैं, बट दोज हु बिल्ड देमसेल्व्स दे कैन लैंड अप द गुड जॉब आल्सो. So it entirely depends on you how you absorb whatever we teach you and how you perform whatever the any college would teach you. So MBA और MHA में कोई difference नहीं है. What we see our students get, अभी जो इंटर्नशिप कर रहे हैं 6 months की इंटर्नशिप कर रहे हैं 5 months की इंटर्नशिप कर रहे हैं, at the end of third month lots of students had secure the job also within the hospital setup. तो कोई डिपेंड नहीं है. एंड एडिशनल कोर्सेज की जो बात करते हैं ना, वो एडिशनल कोर्सेज की बात जो करते हैं कि भाई क्या सीखना है, सो द लर्निंग इज नेवर एंडिंग. ठीक है ना. एआई किसी को सीखना है तो एआई सीखने के लिए एडिशनल पाइथन लर्निंग और वो सब कुछ भी करना है, या हॉस्पिटल में आपको जाना है और मार्केटिंग में इंटरेस्ट है, देन यू वुड वांट टू परस्यू सोशल मीडिया मार्केटिंग. तो वो एक अलग डायमेंशन है. तो कहीं पे भी हम जब भी जाते हैं, बेस्ड ऑन योर interest and based on the demands, you can add the feathers in your weapons. So depends on you. But as a MHA, there is no difficulty to secure a job compared to MBA.
Okay. And sir, one more last question.
Please, please,
Like,
this
yeah,
this will be your
like,
last.
yeah, like if someone has completed MHA or MPH, so if they want to come into a professor line, so NET exam is compulsory. So is it
Yes.
like that we have to gain 1 or 2 years of experience, then only we can give NET exam and eligible for that professor?
So डिपेंड्स ऑन द कॉलेजेस. देखिए बहुत सारे कॉलेजेस जो होते हैं ना, जो असिस्टेंट प्रोफेसर्स की या फिर ट्यूटर की या लेक्चर्स की पोजीशंस निकालते हैं. सो डिपेंड्स ऑन द पोजीशंस, दे कैटेगराइज देम. आपने नेट पास कर ली, फिर उसके बाद आप फ्रेशर्स हो तो देन यू वुड बी लैंडिंग ऑन द ट्यूटर और द लेक्चरर पोजीशंस. If you gain certain experience, if you obtain the PhD degree, then you would be able to land up the assistant professor job. So depends on the colleges, depends on the job profile. You need to work around, but it's not necessary कि वो नेट के एग्जाम्स के पास अगर असिस्टेंट प्रोफेसर में इफ यू सी यू फिट, दे कैन हायर यू.
ओके, नहीं मतलब सर मेरा ऐसा क्वेश्चन था कि मैंने नेट एग्जाम दी, पर मतलब असिस्टेंट प्रोफेसर के लिए भी मेरा एक्सपीरियंस ऐसा होना चाहिए कि फिर डायरेक्ट लाइक आफ्टर कंप्लीशन ऑफ MHA आई ट्राई टू स्टडी फॉर नेट एग्जाम एंड देन आई विल बी लाइक इफ आई कंप्लीट और आई स्कोर देन आई विल बी एलिजिबल. एक्सपीरियंस जरूरी है कि फिर ऐसा मतलब लाइक
Maitri,
कॉर्पोरेट.
let me tell you, most of the colleges who are very good with the courses, they seek experienced person. I hope I'm able to answer that. So I am an assistant professor at IIPHG. I had 15 years of experience after my MBBS and MD. So it depends on college. Here they do not hire the freshers, but depends on the colleges. They set the targets, they set the criterias. So I hope I'm able to answer. And if you have more queries, you can call Ajay or uh, Prem. They can connect you with certain faculties if you have more questions. But most of the institutes, they would seek the experienced person to have as an assistant professor.
Okay, thank you.
Thank you. Thank you.
Okay,
We can
sir.
move with the next question.
Shruti Lata.
Yes. Am I audible, sir?
Yes, yes.
Okay, thank you for sharing everything. So I have also applied and currently actually working. And no, I just wanted to know about the entrance exam that is upcoming. Can you share the timing of it, as I am currently working and also engaged in other things, so I will be able to set my priorities according to the timings also.
Yeah,
So,
so most of the entrance exam which are being conducted virtually, it will be on Sunday. Am I correct, Ajay? Please
yes, sir. Yes,
elaborate.
sir. Yes, sir. So it will be on Sunday, and the time would be around morning time. We will keep it around 10 or 11. We'll share the before, I think, 1 week.
Okay, so it won't be after afternoon, right?
No, it will be in morning, 10 or 11 a.m.
Okay, thank you so much, sir.
Yeah.
It will be 1 hour, I guess. है ना, Ajay?
50 minutes. The duration is 50 minutes.
50.
Yes. Once the student has started their examination, from that point, 50 minutes.
पर इतना सारा टाइम दोगे यार, क्वेश्चंस बहुत इजी पूछ। ठीक ठीक, चलो नेक्स्ट। हाँ ठीक। Any more questions?
Hello, sir. Hello, sir.
Yes, Gaurika. Yes,
Hello,
please.
I'm Gaurika. Sir, my question was that for someone who has done their graduation in a non-medical course, um, what is like, is that any sort of does how much role does that play in our application, and how much role does it play if we get selected in the course, and like, is that a
Job
sort of
placement.
obstruction, or yeah?
Yeah. So let me tell you, currently I had hired 2 students from IIPHG who had experience of almost 3 years in the field. So I had hired from developing the content for frontline workers of health facilities. One of them had completed non-medical courses during their graduation, and one of that had completed uh, BHMS or BAMS. But both have been provided the same job. So for job placements, it's up to you how you build up. My previous student, when I used to teach in IHMR Jaipur, uh, I had one student who is now working as a UNICEF officer, the health officer. So depends on your how you build up yourself after graduation, and that's up to you. And if you are more serious about this profession, you can reach wherever you want to. So that's about the job and the career perspective. Now about the admission. For the admission, there is no differentiation between medical and non-medical. That we do not keep this differentiation. For the interview process, again we keep no differentiation. So that's up to you how you prepare yourself, because during the interview and during the exams also, we do not test you for your uh, skills or your knowledge on public health, but we test you for your absorption, your receptiveness, and your zeal to do this in course. So there is no differentiation for medical and non-medical. Yeah, but during the courses, for what I have seen, some of the non-medical, basically there are a couple of few from the engineering background, in Master of Public Health. Some of them had been working as a finance assistant as they had completed the BCom, and they had to struggle more. They have to gear up more for reaching up to the certain levels. So that's the generalization, not a specification for particular course.
Okay,
So
sir.
there is
Thank
no
you so much.
differentiation in admission process. There is no differentiation in career perspectives.
Okay, sir.
Sir, I have similar kind of question. Actually, I belong to BSc Nursing. Finally, I have completed my graduation, and now I'm little
Yeah.
bit confused that what I have to choose, like from MPH and MHA. But actually, I have certain kind of question that there is a differentiation between someone who has done MBBS or BHMS because they are the doctors and they belong to the field like nursing. So, is there any possibility that they are given more chances to have placements, and someone like from the BSc Nursing or physiotherapists or non-medical fields are like I have
So,
similar kind of question just before. Yes.
so in my previous projects, there were 4 employees, and 3 of them had completed the BSc nursing because they had worked for them on the research part. So I had a project related to research where they can design a research, they can conduct the entire operations for 8 states. So I had a BHMS also. We used to have less number of MBBS uh, in these public health professionals. Uh, Few of them, they are more equipped with the existing knowledge because the public health has been an entire subject of MBBS and BDS background. So apart from that, the other positions, other professionals, those who have completed graduations in medical and non-medical background, there is no differentiation in the career perspectives.
Okay, sir. Okay, thank you.
Yeah. So recently in my projects, I need BSc nursing who is specialized with MPH for the UP project. So that's the part where the job prospects entirely depends on the need of the government or the development sector. So our donor had requested a person who has the knowledge of nursing care and also have the knowledge of public health. So they used to ask us to hire someone from that background.
Hello, sir.
Hello,
Shri
Janki.
Raghuram, Shri Raghuram, you have raised hand since long. You can
Ah,
ask your
yes,
question.
sir. Yes, sir. So, hi, sir. Myself, Sri Raghuram. So,
Yes.
sir, I actually have a question. Like, I would like to understand the difference between the traditional MPH program, like that one is offered in IIPHG, as well as like in IIHMR Jaipur, as you said, like they provide like associated with
MBA.
MB. So, like, I do have a like what to choose. Like, is it like better than this particular thing you are providing in like IIPHG, or like so? Basically, that's the question, sir.
So I used to teach as a visiting faculty to IHMR, and where they had a MBA healthcare management courses. It's kind of similar courses of MPS. There is no differentiation on just only the nomenclature. So we have been registered as a public health universities, and we follow the UGC rules as a public health universities, where certain universities like IHMR, they have been recognized as management universities. So they had to nomenclate their courses accordingly. But for the uh, subjects that we used to teach them, and they used to uh, create around their MBA courses and our MBA MPH courses, they are almost same. But here at IIPHG, you would get more about the field experiences compared to IHMR, and also the cost is quite less here.
Okay, sir. So the when it comes to like career opportunities, like there is a difference, sir. Like for this MBA, MPH, or
No,
somebody like
no.
no.
So
Okay.
I was in the NHM, and we used to have a when we go for the advertisement, we used to keep both the positions, both the graduation at the same level. There is no upper and lower. And in the development
Okay. So they
sectors recently, and the IHAT, which was an UNDP also, which has posted almost 178 districts consultant, where they used to hire the both the section, because in India it's common in the knowledge that MBA in healthcare management and MPH are more commonest part of graduation. So they are the similar, and they do have a same knowledge and skills that they seek from the students.
Okay, sir. Thank you so much, sir.
Thank you. Thank you.
Hello, sir.
Hello, Joel.
Hi, sir. My name is Dr. Joel, sir, and by profession, I'm a doctor. I'm currently working in a palliative care setup for the last 2 years. So I had a doubt. So I envision myself working with intelligence officer down the lane after 5, 10 years or somewhere. So how would IIPHG would help me in fulfilling my dream as such?
So you would want to work in the health intelligence
Yes,
on the digital part, AI and ML?
not just AI, sir. More of a surveillance kind of a setup.
Okay.
As
Okay.
in with EIS India or
So there are certain ICMR kind of institutes, and also there is an NCDC institutes where
yes,
they
sir.
used to work around the disease surveillance and disease intelligence,
Yes.
where they do have a mixed of dimensions, where the public health person and the engineering part, those who are working with the and the urban planning, they used to work around the environmental planning, they used to work around the public health planning also. So all those experts sit together and working towards a certain disease intelligence. So similarly, in recently the WHO had developed disease intelligence program with the help of World Bank across the country. So they had identified the 6 regions where they are going to hire in next couple of years for these kind of experts. Yes, IIPHG does have that courses of data analytics and data visualization, where you can be equipped to understand the data. Similarly, there are courses where around the communicable disease and non-communicable disease, where you will get the entire epidemiological understanding of any diseases. And based on your understanding of data and these subjects, you can be equipped yourself with the intelligence or the surveillance officer. So uh, I have shown couple of slides back where our students were placed in WHO. They had been working as a surveillance medical officers for vaccine preventable diseases. So those were the state level positions or the certain geographical positions where they are working for reductions of vaccine preventable diseases. So yes, IIPG can help you to build your understanding into those areas, and also equip you with the knowledge and resources where you can secure these jobs.
Thank you, sir. Thank you. Sir, do we have data analytics in our MPH current courses?
Yes. Biostates and data analytics both.
Okay, sir.
And we from this year onwards, we are also going to introduce value added courses with the help of AI. So AI in public health, we are going to add that value added course from August onwards. So you would have that opportunity to learn the AI also
Thank you,
if
sir.
you
Thank you so much.
apply IIPG. Yeah.
Thank you, sir. That was the presentation was very insightful, sir. And
Thank you.
thank you for your time.
Thank you, Joy. Thank you.
Good afternoon, sir.
Hi, Pritam.
Yes, sir. Sir, actually, I have already done my MH, and after that, sir, actually, I recently uh, uh, get a chance for training in a QCI. And secondly, मेरा सर क्वेश्चन यही है सर, मैंने एक्चुअली रिसर्च फील्ड में मेरा एक्चुअली जाने का थोड़ा इंटरेस्ट है, इसलिए मैं एक्चुअली सर सोच रहा हूँ आफ्टर एमएच है, मैंने एक्चुअली एमपीएच करने का मैंने एक्चुअली सोचा है, सो बेटर पीएचडी में मैंने इन डेप्थ रिसर्च करने के लिए। तो सर मेरा जो सर प्लानिंग है ये सर सही है कि, और मैं अभी थोड़ा वर्क एक्सपीरियंस गैदर करके फिर पीएचडी में एंटर करूँ? सो
See, I did have a colleague who had completed MHA from IHMR and had took the admission and graduated from IIPHG for the MPH. Abhishek Sen, he was one of my colleague. मैंने उसको यही बोला था कि if you want to acquire your certain skills, there are lots of courses available on the various platforms. You can go through the Coursera, you can go through the Udemy, you can go through the various universities who used to run the virtual courses, and then you can get that knowledge, you can acquire that knowledge. But for the job perspectives, if you want to go for the ICMR, if you want to go for the certain organizations or certain institutes where they used to hire researchers, they go for uh, postgraduates who had completed MPH. So for you, if you are interested only to learn the research, I would suggest you to go for virtual courses or any workshops that are being conducted for research designs or research understandings. You should not be taking the admissions only to acquire the research knowledge. But if you want to understand the public health, then you should only go for MPH courses. Since you have completed MHA, that's why I'm saying.
एक्चुअली सर मुझे पब्लिक डोमेन में एक्चुअली मेरे रिसर्च करियर को आगे ले जाना है, तो इसलिए मैं एक्चुअली सर
Yeah, so for that you should get the admission in MPH, because research है ना एक dimension है, but to understand the research you should have the wider understanding of public health, and the MPH course is going to give you. But if you only wants to understand what are the research designs, what are the research types, how to conduct a research, there are lots of courses are available. But if you want to pursue the career for researcher in public health, then MPH course would be the better option.
सर जो मेरा सर एमएच बैकग्राउंड है सर, ये क्या कुछ करेगा इन फ्यूचर में, मेरा फ्यूचर कोई रिसर्च
Obviously ना, obviously आप जितना पढ़ोगे वो हेल्प करता ही है. See, I have completed the MD in public health. The PSM करके एक सब्जेक्ट होता है, उसमें मैंने MD किया है. Then after that, I have completed fellowship in epidemiology from CMC Vellore. और उसके बाद आके मैंने PhD किया है. So whatever you learn ना, you would have the upper hand in certain aspects. तो learning तो हर एक बार आपको ऐड करेगा ही. Whatever the knowledge you gain, your brain gets 1 gram of size from that knowledge.
सर क्वेश्चन सर एक्चुअली सर जो यहाँ पर मैं सर एमपीएच के लिए सर एडमिशन लूंगा, तो सर मुझे क्या सर कुछ रिसर्च ओरिएंटेड वर्क के लिए सर कुछ एक्स्ट्रा कुछ मिल सकता है, क्योंकि मेरा पास से फोकस तो रिसर्च ही है, सो रिसर्च असिस्टेंट, रिसर्च असिस्टेंट, ऐसा कुछ रिसर्च ओरिएंटेड प्रोजेक्ट.
सो बेसिकली क्या होता है कि जैसे कि हमारे बहुत सारे स्टूडेंट्स दे आर वर्किंग विद ICMRs राइट नाउ एज ए रिसर्च साइंटिस्ट एंड एज ए रिसर्च असिस्टेंट्स. जैसे कि मैं एक सिंपली बताऊं कि टीबी का प्रोग्राम है जहाँ पे टीबी इन्फेक्शंस है, तो वहाँ पे टीबी इन्फेक्शंस को कैसे कर्टेल डाउन करें, देयर इज अ रिसर्च रन थ्रू द ICMR स्पेशली ऑन द फैक्ट्री वर्कर्स, तो सिरामिक इंडस्ट्री में जो वर्कर्स है, सो वेयर दे ओनली रिक्वायर द पब्लिक हेल्थ रिसर्चर्स. बट एक प्रोजेक्ट है जहाँ पे हॉस्पिटल बेस्ड रिसर्च है, तो वहाँ पे उनको MHA विथ रिसर्च का एक्सपीरियंस वाला चाहिए. सो व्हाट आई वुड सजेस्ट यू, take a time, take a note and pen, list down your requirements, list down go for the DevNet jobs or the hospital kind of job portals, और कहाँ पे आपको लैंड करना है, then you need to decide. So I'm sorry Ajay and Prem, but let me tell you frankly, you need to understand कि अगर research ही है आपका dimension या understanding, don't go for the MPH course.
Okay, sir. Thank you, sir.
Good afternoon, sir.
Yes, Sanji.
Yeah, so actually I had a doubt regarding the internships. So summer internship and final internship, are they provided by the institute itself, or we need to search them on our own?
Sanchi, we do have two options. So most of the students क्या होता है, they are from across the India. So some of the students are from Kolkata, some of the students from Northeast also, some of the students from Himachal or Jammu and Kashmir. So they wants to do the internships nearby their houses, nearby their home. And if there are organizations, they are in touch with them, or there are certain positions that the organization seeks from IIPHG, we connect them for the 2 months and the 6 months of internship or the dissertation period. But we request all the students to get the experience from the government institutes. And IIPHG had strong collaboration with the state governments of Gujarat and other state governments where we used to facilitate you for the internship. So if you do not want to search, there is an options, and we do have a lots of students that are working internship in state governments.
Right. Okay. Thank you. And I also had a question that I am from a BTech bioengineering background, like I'm in my final semester, and I'm currently doing my research internship. So, like a lot of internships here, like, it was a struggle to find research internships from a bioengineering background. So, will it be will my background be kind of like an
No,
asset
no,
or
no,
an hindrance for public health? Because
not
I
any.
haven't seen a lot of the people from my background maneuver into public health as well. So what
So
is the scenario?
so there is no hindrance for the internship also and for the career perspectives. So once you get the MPH degree or the MHA degree or the PhD degree, you will be known as graduates from those degrees, not from the basic graduations of bio.
Right.
So
Okay.
there will be no hindrance or the obstacles to get the certain careers or during internships and education. Of course, there are none. We have not seen since last couple of years.
Okay. Thank you.
Thank you.
Hello, sir. Good
Yes, sir.
afternoon.
Good afternoon.
I am a dentist. हाँ, मुझे ये पूछना था कि अभी मतलब एमबीए और एमएचए में मतलब फ़र्क क्या है? क्योंकि आई गॉट लॉट ऑफ न्यूज़ फ्रॉम समवेयर कि एमबीए इज़ अ वाइड स्प्रेड ब्रांच और एमएचए में मतलब वो इतना सीमित हो जाएगा, हॉस्पिटल एक्वायर्ड जॉब ही मिलेगा। एमबीए में यू कैन डू लॉट ऑफ थिंग्स। सो आई वांट टू आस्क यू कि मतलब क्या है ये?
See, apart from being a faculty of IIPHG, अभी education systems में क्या हो गया है कि the nomenclature works in the different segments. The dimensions are different, but what I have seen across the country, I've been working with the health sector since last 15 to 20 years, and I've seen that MHA or MBA hospital administrations में कोई differentiation नहीं है. Because the subjects we teach you here at MHA, and they used to teach you at different institutes that more or less same. क्योंकि यहाँ पे भी मैनेजमेंट प्रिंसिपल्स है, यहाँ पे भी कम्युनिकेशन प्रिंसिपल्स है. वी यूज टू टीच द अकाउंटिंग्स आल्सो इन एमएचए. वी यूज टू टीच यू द मार्केटिंग ऑफ हॉस्पिटल मार्केटिंग आल्सो. तो यहाँ पे तो सारा है ही. एंड इफ यू गो टू द अदर एमबीए कोर्सेज, certain segments you would not find, like the quality assurance that we used to give you the experience of NABH. QCI खुद कैंपस में आके पढ़ाता है. And the QCI is the Quality Council of India. State यानी हमारे इंस्टीट्यूट में आके NABH पढ़ाता है. There are certain medicines or certain organization, they used to come within the campus to teach you the hospital operations. So uh, I had seen no difference between MBA and MHA. That's my observation.
ओके सर, थैंक यू।
Thank you.
Good afternoon, sir.
Good afternoon, Sinal.
Sir, I have recently did my bachelor's in microbiology and nutrition, and I'm interested to do my further studies in nutrition public health. So, which would be the better option for me to do the further studies? Can you give me any suggestion, like just the MPH or MPH with PHN or MHA? I'm confused between the three subjects.
Yeah. Swinal, सबसे पहले मैंने ये नाम पहली बार सुना है. Swinal. What is the meaning of Swinal? और कैसे प्रोनाउंस होता है?
Swinal आपने करेक्ट प्रोनाउंस किया सर.
ओके. और मीनिंग क्या है स्विनल का?
Heaven, heaven,
हेवन.
heaven sweet.
Okay, okay. Yeah. Now regarding your questions, see, recently the public health nutrition is taking more of requirements across different programs. तो गवर्नमेंट प्रोग्राम्स है, ऐसे ही एक चलता है WCD डिपार्टमेंट, वुमेन एंड चाइल्डहुड डिपार्टमेंट. दे यूज्ड टू रन द Anganwadis where they used to teach nutritional aspects. Similarly, education department had started to work around nutrition to tackle undernutrition also and obesity also. So if you are interested in public health nutrition, then definitely MPH with the track of PHN would be helpful. यहाँ पे first year of MPH and PHN would be the same, but from the second year there will be the differentiation where you would learn more about the uh, human nutrition, dietetics, certain segments about deep intricacy of nutrition. You will have that kind of knowledge in the PHN. So for the career perspectives, both are equal. MPH with the track of PHN would give you the double edge weapon. So you would have a MPH knowledge also, and you would have a PHN knowledge also. For the job perspectives, they will be seen as a MPH similarly. But if you have the PHN also, so certain nutritional programs would hire you faster compared to the PHN. But depends on the market, there are jobs or not. That is a fluctuating part. हर बार ऐसा नहीं होता कि PHN की लार्ज नंबर ऑफ जॉब्स मिलेगी यानी न्यूट्रिशन की, बट MPH की तो होगी ही. सो डिपेंड्स ऑन योर understanding, depends on your zeal. You can opt either MPH or you can go for the PHN. We are there to assist you for the career prospects. So जब भी हमारे प्रोजेक्ट्स चल रहे हैं न्यूट्रिशन के पास और एजुकेशन डिपार्टमेंट के साथ, वहाँ पे जो भी स्टूडेंट्स होंगे हमारे, और NIN करके institute है, National Institute of Nutrition, that are from the ICMR, they also used to hire the MPH with PHN track. तो बहुत सारी जॉब प्रोफाइल्स है where they seek only MPH with PHN. They do not only seek the MPH people. So there are pros and cons for MPH PHN. You need to calibrate your requirements and please apply accordingly.
Thank you,
Hi,
sir.
hi,
Hello,
sir.
sir. So I would like to add in a question as well, sir. So basically, sir,
Shri Raghuram, let's you can ask in the chat box. Let's
okay,
have the others to ask.
okay.
Hi, sir. Good afternoon.
Good afternoon, RJ.
Yeah, okay. Actually, I just want to inquire. Actually, last year I had got admitted into Harvard University, Chan School of Public. But due to this visa tensions, I couldn't join then. Okay. But then I came to know this IIPH Gandhinagar, and I was particularly checking for the outcome, like students who joined in with consultancies, firms, or any healthcare related those areas. Because after my degree, I had worked in Dubai in a pharmaceutical company as business development associate, and I'm particularly drawn with consultancies, strategies, and a patient outcome or those related areas. So I was particularly checking for alumni or any other reference who joined similar organization after IAPH. So what is your take on those outcome? Yeah.
So many of our alumni are working with the, as you have seen the slide deck, the PwC, the Deloitte, similarly working with the Grant Thornton, those type of consultancy. They are closely working with the government, and they are closely working with the pharmaceutical industries also. In the hospital backgrounds also, there are lots of consultancy nowadays to support the hospitals, the multi-specialty hospitals across the country, like Fortis, like Apollo also. They used to hire the consultancy agencies, and the consultancy agency assists them for day-to-day operations and certain uh, the quality control parameters or the infection control parameters. So many of alumni had been working with these consultancy agencies. Recently, in Gujarat also, the World Bank project had created the technical support units, then where they had hired lots of consultants who are going to support the state government and Grant Thornton had hired our 4 alumni from IIPHG. They had passed MPH and some of them had passed the MHA also. So yes, our alumni are working across these consultancy segments. It depends on the person that how fit they feel put to the particular job profile. I hope I'm able to answer.
Yeah. Thank you, sir.
Yeah. You can be in touch with
Hello,
Ajay,
sir.
Marjan, and they would guide you more about, they can provide you more details where our alumni are working currently. They do have a landscape of our entire alumni profile.
Okay. I will do that.
We can take
Hello,
last
sir.
2 questions now. Last 2.
Yeah.
Yes, Vasundhara.
गुड आफ्टरनून सर। सर जैसे कि ये जो एमपीएच प्रोग्राम है, मैंने एमपीएच एमएच और मतलब न्यूट्रिशन और हॉस्पिटल मैनेजमेंट तीनों को अप्लाई किया था, लेकिन अगर आगे चल के मुझे सिर्फ एमपीएच के लिए ही मतलब यूनिवर्सिटी को बताना होगा तो वो प्रोसेस हो जाएगा? मेरे रजिस्ट्रेशन में तीनों कोर्स के लिए हुआ था।
हाँ। So those who have filled up all 3, they
अच्छा।
had to put preference. अगर अभी MHA रखा है या PHN रखा है और बाद में आपको change करना है, so you can do that. Ajay,
ओके सर।
is it correct ना?
Yes, sir.
Yeah.
Sir, there is a question in chat box.
Yes.
Sir, according to you, MPH or MHA, which has more career opportunity, which has better placement?
See, in recent last 1 or 2 years, we had received about 70% of students from the female, and their gender were females, and many of them had to prefer localizations for the career perspectives in MHA. Specifically, I'm talking about MHA. So as a placement wise, both used to get the jobs at the end of the graduation or during the reservation period. Most of the students, about 70% to 80% students, they used to get jobs during the dissertation period before completion of their graduation. देखो 10% स्टूडेंट्स तो हर एक जगह पे कुछ ना कुछ रहते ही है। हमारे यहाँ पे परसेंटेज वो 1% पे है। Ajay, sorry, but basically I used to say that. But most of the students, those who acquire a job and they are serious about them, there are no limits. बहुत सारे alumni, they are leading the hospitals across the country. Some of them are working in Medanta, some of them are working as a insurance officer for large chain of hospitals. तो वो तो है ही. Depends on you how you build up yourself. For the public health, there are opportunities are more, और उसकी geography bound नहीं होती. तो if you are okay to live without boundaries and to have lots of experience across different culture and geographies, the MPH is for you. So differentiation कहीं पे भी नहीं है if you build yourself up to the particular knowledge. So some of the अभी एक स्टार्टअप में काम कर रहा हूँ, वो उसने MHA किया है एंड दे हैड शिफ्टेड देयर अंडरस्टैंडिंग कि उसको स्टार्टअप ही करना है. So for AI startup, for EMR, they are working towards them and he is now building a large level of companies. So depends on you. कहीं पे भी आप कोई भी जगह पे जाओगे, how you build up yourself is the last key options. We can be the instruments in your journey. We can help you to build their directions. And overall scenario यही है कि MPH MHA jobs तो है ही, बहुत सारी है, but आपको सीढ़ियाँ कैसे चढ़नी है, कितनी जल्दी चढ़नी है, that depends on you.
Hello, sir.
Yes, Rushika.
Sir, I have a question about MHA which I am interested right now. So, sir, there are certain courses of MHA which is bound to be 6 months, and IIPHG is of 2 years courses. So I want to just ask that what is the difference between them?
Rushika, can you repeat that? मैं समझ नहीं पाया.
If I'm not audible, can I just text in chat group
Yeah,
Sir,
or
please,
is
please.
asking that there are some courses which are of MHA which are of duration of 6 months, and IIPHG is providing 2 years degree. What is the difference between these two?
So the online or the virtual courses or the 6 month courses would not take you to the entire dimensions of hospital management or the administration. So 6 month courses में आपका subjects बहुत कम होंगे. Every year we used to take almost per semester you are going to through the 250 hours of learning. ठीक है ना. तो आप सोचो 6 मंथ्स का एक है वो हम आपको 250 4 बार पढ़ाएंगे और वो एक बार पढ़ाएगा. So the subjects would be less compared to the 6 months courses. And if you want to build your career in the hospital management or the hospital administration, they used to seek full-time MHA graduates, not 6 months or 1 year diploma courses.
And even they will be a certificate course or diploma course. When hospital or consulting organization is hiring, they always ask for a degree. Not they will not consider diploma or a certificate course.
thank you, sir.
Thank you. Thank you.
Hello, sir.
Hello.
Sir, I want to ask you. Actually, I have already tell you that I am from a BSc nursing. I am a BSc nursing student, passed out from Gujarat University. So, sir, which will be better for me to further go for my further studies, like MPH or MHA? Because in our studies, in my nursing studies, I have learned about community. We have two subjects from community 1 and community 2, and I have also interest in hospital administration. As a clinical nurse, I have worked as an intern nurse for the 6 months in Epic Hospital. So, what would be better for me to choose for my further studies, MPH or MHA?
So again, let me tell you, मैं जब PG courses ले रहा था, then I used to get the surgery also. I used to get the skin also. I used to get pathology also, MD pathology और सभी जगह पे. But I was more interested towards getting PSM. तो वो मुझे public health करना था. ठीक है ना. So that entirely depends on your taste and your interest. अब मैंने पीएसएम क्यों लिया, बहुत सारे लोग पूछते हैं, तो मैं उनको बोलता हूँ कि आई डू हैव अफेक्शन टुवर्ड्स द पब्लिक हेल्थ. तो आपको डिसाइड करना पड़ेगा कि वेयर योर अफेक्शन इज, इन द हॉस्पिटल्स आल्सो और यू वांट टू गो इनटू द फील्ड पब्लिक हेल्थ. आई कांट आंसर यू करेक्टली. You need to find out the answers. You need to be your Buddha.
Yes, sir. Thank you. Thank you. Yes.
Hello, sir. Uh, uh, I have hello.
Yes, yes.
Sir, I have done my graduation in BMS. So it's good for MPH या MHA or फिर MHN.
Pardon?
मतलब
Ajay, can you answer this? I need to take one call. Ajay?
Yes, sir. Yes, sir. I'm here only.
Yeah,
What is your question, sir?
can you please repeat the question once? Hello.
Yes, can you repeat your question?
Sir, actually, my question is, yeah, I have done my graduation in BMS, so and I want to do MPH. So it's good for me for career opportunity as a Ayurveda student. Yeah, as a Ayurveda doctor.
So actually, Vashundhara, we do have a student from BAMS, BHMS, MBBS, BDS, BPT, nursing background, and they are doing well after completing their MPH degree. There is a student who has completed BA AMS and now working as a surveillance medical officer with the UNDP with Quest Corp support. They are working with the IHEad. So, and whether you are confused about the MPH and MHA or you are confused about the MPH itself.
Yeah. Yes, sir. Yes, sir.
Okay. So between MPH and MHAC, both the courses are specifically very much different. One is with working with the community, which is more working toward the research part. With the MPH graduates certainly work for the awareness of the certain government program. They work for the planning, implementation, policy framing. On the other hand, MHA is a managerial and management kind of job. When graduate used to work as a hospital administrator, the quality manager, quality associate, the accreditation officer, the administrative officer. They used to lead a specific department or working as a CEO, CO level in the hospital. So uh, one area is specifically working into the field with the for the program implementation, for the awareness of the certain diseases, for the awareness of the national programs, and the other hand, the MHA program is specifically working for the management side and the administration side. Now it is up to
Okay.
you. On the basis of your inclination, you can decide out of both of it. The placements, the starting salary would be almost same for the both the graduate.
Okay. Thank you, sir.
Any
Any
other
other
questions?
question? Any other doubt?
Just a quick question, sir. Good afternoon. Sorry for that.
Right.
Just one little clarification. Dr. Harsh was talking about how MPH versus MPH PHN, uh, the jobs are somewhat limited in terms of what's the demand that year for hiring. So could you just paint me a picture in terms of, say, out of 10 jobs, how many would be just like accept you with MPH versus if you have MPH PHN? Um, because
Eight,
I have a
eight by
background
two.
in, sorry.
8 for MPH and 2 for PHN.
All right, thank you so much. Because I have a background in science writing and I specifically have covered nutrition. So I feel confident in my knowledge and self-learning capacity for nutrition. But I just didn't want to pigeonhole myself in like a very niche sort of environment. That's why I wanted the clarification. Thank you so much.
Thank you. I got many of the personal direct messages regarding the interview process. So for the interview process, it's not complex, frankly speaking. It's available on virtual, or you can. We would prefer you if you come in person. By that you can see the campus also. You can meet the faculties also. You can meet the team also. So for the interview process, if you get selected for the personal interviews, basically जितने भी एग्जाम्स देते हैं उससे 30% to 40% एलिजिबल बनते हैं इंटरव्यू के लिए. ठीक है, तो 40% जितने भी आएंगे उसमें से हम उनको ऑप्शन देते हैं वर्चुअल आना है या यू कैन गो एट द फिजिकल इंटरव्यू प्रोसेस. So Anushka had asked me the questions कि what is the process of interview. Interview process में simple है. There are certain sections that आप why you want to pursue the MPH or the MHA. What's your understanding that would you have? So that kind of question that starts with. Another part is what's your understanding on certain public health problems or the hospital based problems. तो आपको खुद को क्या लगता है कि ये प्रॉब्लम्स क्यों है और क्या है. सो बेसिकली we do not seek the information from you, but we expect you to have the invocative answers where you do have certain understanding about certain topics. ठीक है ना. तो and that will be only around the public health or the hospitals or Indian healthcare systems. हम ये नहीं पूछेंगे कि आपको क्या लगता है ईरान और अमेरिका की वॉर्स के बारे में. We will ask you that if there are disasters and there are lots of people who are going to be affected by the war, and what's your understanding that how can we make it better in terms of hospitals and in terms of public health? So these kind of questions that we used to seek from you. Apart from that, we also assess as a person that how you are ready to land upon this public health or the hospital administration or the PHN. So it's a simple interview process, 20 minutes. Earlier we used to keep the debate session, but वो debate session बहुत heated हो जाता है. So we had stopped since last 3 to 4 years कि वो group बना के उनको debate कराए. So this is only 20 minutes personal interviews and it's easy. It's lighted mode में होता है. और आपका क्या इंटरेस्ट है, व्हाई डू यू वांट टू परस्यू दैट वी असेस यू ड्यूरिंग द इंटरव्यू प्रोसेस. दैट्स ऑल. I hope Anushka I am able to answer that. Yeah, if there are no more questions, I need to leave. You can ask the questions to Ajay and Prem. Do you have any
Sir,
questions? I can
what
take the
about
last.
fee structure?
You can see the chat box, or you can have the brochures itself also. That is available on websites.
Yes, thank you. Thank you so much, sir. Thank you so much. I have already put up the email IDs and the contact numbers. If after this session anyone is having any confusion, any question, any doubt, you can reach us anytime on the given email IDs and contact numbers.
You can call them. That would be easy to have that immediate answers. And I see Prem and Ajay, they are on the call almost every time. मैं जब भी बुलाता हूँ तो भी वो कॉल पे होते हैं. So in these couple of months, but what I would request you, complete the application process. That's the first step. बहुत सारे लोग ऐसे होते हैं कि they do not go for the application and then they used to ask us कि सर डेट चली गई है. So what I would suggest you to fill up the application as soon as possible, क्योंकि फिर वो टाइमिंग्स नहीं मिल रहता. ठीक है. So thank you everyone. That's all from my side. Thank you Ajay. Thank you Prem. I need to leave Ajay, please.
Yeah. Thank you, sir.
Yes.
Thank you so much, sir.
Thank you.
Yes, if anyone is having any question, any doubt, you can contact us on the given email ID and the contact numbers. We are closing the session for the now. If you have not completed your application yet, we request you to complete your application as soon as possible, because once you complete your application, the further updates, the details will be sharing on your registered email and the contact numbers. Thank you everyone.
Thank you.
Thanks again. Thanks, Ajay.
Thank you,
Thank
sir.
you, sir.